Good afternoon. We got a full update today, so we're going to jump right into the case update. Today, the North Dakota Department of Health confirmed 13 additional cases of the novel coronavirus disease or COVID-19, 5 from Burleigh County, 3 from Stark County, 2 from Cass County, and 1 each from McIntosh, McHenry, and Ward counties. That takes us from 45 where we were yesterday with that 13, our biggest increase yet in daily positive counts to 58. 11 of those individuals are hospitalized. In context, how this fits in nationally, we're weeks behind where some other states are, but the U.S. now is topping 80,000 cases and over 1,000 deaths today. So we're still trailing Spain and Italy in terms of number of deaths, but we're also behind them in terms of the curve. Being on the National Governors Association call today, including with President Trump and Vice President Pence and other leaders, it's apparent that other governors that are further into this are running into very stressed situations in terms of medical supplies and hospital beds, and particularly intensive care hospital beds that have ventilators and appropriate staffing. So we continue to work round the clock on a planning standpoint here in North Dakota, taking all of this very seriously, as everybody in the state should be. As of noon today, we still had 1,390 collection kits at the Department of Health lab ready to send out to places that might be requesting them. We had the ability to run here in the lab when those kits come back in over 3,300 patient tests. So again, we have right now the ability to do more testing than we have been doing in North Dakota, but we did have another good day with 306 tests coming in. That brings the North Dakota totals up to 2,261 people that have been tested, again with 58 positive and 11 of those hospitalized. There was yesterday a brief discussion. We do report this by county. There have been some folks, a lot of discussion on social media, saying, oh, that person's not in our county. We can only report this based on the addresses that people have that they provide when they do their testing. But I should just remind people, it doesn't really matter whether or not there's 0 positives reported in a county or not, because by the end of next week, it's likely to assume, we should just assume, if you look at other places, the way the rate of spread is that we will have positive cases in every county in the state. We should just assume that that's where we're going to be going.